Thank you so much. I felt very sorry to have to cut you off because
Stop the screen share.
I felt very sorry to cut you off because it was actually very interesting, and also the way you bring it, it's very exciting. So thank you for this lesson on brain development and how it works, and how your brain development really also decides how you act as a young adult in life. So thank you so much, Dr. Tomasini. And from the brain we go to a great project of the UNODC, CHAMPS, Children Amplified Prevention Services. And for that, with us is here Karen Peters of the UNODC. She's a public health and policy specialist with over a decade of experience across the United Nations system and global health sectors. She currently serves as Drug Use Prevention Program Officer with the UNODC in Vienna, where she leads cross-sectoral initiatives focused on family skills, prevention science, and evidence-informed policy development. There's lots more to say about Mrs. Karen Peters, but we are very pleased that you're here and that UNODC is supporting our side event, and the floor is yours.
Thank you very much. Firstly, thanks so much to the Women's Federation for World Peace for consistently engaging us on these very important topics and providing us a platform to share some of the work that we are doing with the member states around prevention that links to the topics. Yeah, I would also just like to acknowledge that the presenters before me shared a lot already about the foundations of why we work on systems approach to prevention. Particularly, Hori-san, when you were mentioning around crime prevention is not the responsibility of families alone. We need to have a multisectoral approach. And Attorney Migano talking about every child needs to feel safe and empowered and protected to grow. These are very foundational principles that help to guide the development of our initiative called CHAMPS. So if we go to the first page, oh sorry, the next one. Oh, I can, yay! Okay, I have the power. Okay. When we were developing the CHAMPS framework or the CHAMPS initiative, there were some common objectives that we wished to clarify around prevention science. And we looked at the prevention approaches that were taken at a systemic level. Now, Dr. Tomasini was talking more on the interpersonal level when it comes to individual brain development. The CHAMPS initiative is looking at systems. So more in an institutional sphere on what governments, what organizations, what different groups that are working in prevention can do to contribute to prevention. We noted that there was often very limited approaches that were evidence-based on prevention, and these were specifically only focusing on awareness-raising campaigns around what works in prevention of drug use, or at least for child development. We also noticed that the prevention programs that were available mostly focused on adolescence as a life stage, and for us this was an intervention too late when you're focusing on adolescence. And we also looked at what the evidence shows around vulnerability to drug use, that it is linked to multiple factors and it's not just based on a lack of information. And when we accept that prevention is not just a lack of information, we can see how awareness-raising campaigns is just not sufficient to have effective prevention systems. We based the program or the initiative on what the international standards on drug use prevention say around what works for preventing drug use and other risk behaviors. The international standards that was updated with the WHO in 2018, that's the current version we're using now, is also encompassing substance use prevention, so it's not just about drugs or narcotic drugs. And when we are working on what works on prevention, we also consider that this usually have cross-cutting benefits to other risky behaviors. So what is CHAMPS? Essentially, it is a systems approach to prevention. It supports countries to strengthen prevention across ages age ranges and stages of childhood, from age 0 to 18 years of age. It's aligned with the international standards, and it integrates interventions across families, schools, and communities. It ensures, and it aims to ensure, that no child falls through the cracks, that we have a system in a country that is really essentially covering all the bases when it comes to what can help support that child's development. We have, and of course, the most commonly used data that we know around drug use usually are school-based surveys. This we get from different monitoring and evaluations. But what we normally do when we first engage countries on a CHAMPS initiative is we want to understand what is available at the national level. And this is not only by engaging stakeholders that normally work on drug prevention, but it's really looking at the entire system, including from the education sector to criminal justice sector, what is available during the different life stages and according to the different interventions that the country is offering for children and youth. We have, of course, a global mandate and support. There's 2 resolutions that came out of the Commission on Narcotic Drugs. The first is on establishing, this was the first one, the evidence-based early prevention, or promoting and comprehensive evidence-based early prevention. And we realized after that resolution, the member states realized that wasn't sufficient, that we also needed to have a resolution where countries all agreed to align on promoting comprehensive scientific evidence-based multisectoral national systems for drug use prevention. Right now, our CHAMPS program is running in 10 countries, in Algeria, Argentina, Cyprus, Egypt, Brazil, Ecuador, Greece, Norway, Nigeria, and Uzbekistan. We are currently discussing expansion across other regions as well. We have, and the CHAMPS framework ensures strong collaboration with governments, CSOs, other UN agencies beyond UNODC, academia, because their research component is really so important to our work, and the private sector. Noting also that youth engagement and youth collaboration on these topics is essential, and that youth are one of our key stakeholders, not just to target them as recipients of programs, but to really get them involved in the design and the development of initiatives. And the CHAMPS framework also promotes coordination, avoids duplication, and helps to strengthen the national systems. But this is really what it looks like. There's 2 phases to CHAMPS. In the first phase, usually in the first year, we do a systems mapping and assessment with the government counterparts, the NGOs, and the other key stakeholders, including the youth that we've identified. And we use the tools that we've developed. This one is called Review of Prevention Systems, to help to understand what is available and where are the gaps. Then we choose certain indicators that we want to follow to say, okay, if these are the gaps, these are the areas that we need to strengthen, and that's what we're going to focus on for the next phase. And we do a baseline study. We also develop the research protocol. In the second phase, which is usually the following years, we start with the capacity building, the national implementation, and evaluating the outcome of that. So far, of the 10 countries, only Uzbekistan have completed phase 1. By the end of this year, we will have at least 4 other countries that would have completed the first phase. So it is a long process. It's not something that happens overnight, but it's because we want to be as thorough as possible and offer the best technical assistance to countries. So I'm going to end off by summarizing, and saying that investing in prevention systems also delivers a huge impact. We know that it has an impact on reducing drug use and other risk behaviors, improving mental health and child well-being, supporting more effective and sustainable policies, and CHAMPS turns prevention into a long-term scalable system. So we invite you all to help us to put the safety and well-being of children first, to acknowledge that all children have the right to a healthy and safe childhood, support implementation of evidence-based prevention where and if you can, strengthen your partnerships towards a common goal. We don't have to do this alone. We can work with others to have a greater impact. And that to do that, we would help to champion prevention systems in our work and in our workplaces. And the last thing I want to say is not on the slide, but also the support of our CHAMPS implementation has been generously guided by certain member states, in particular Austria, Italy, France, the Netherlands, Norway, and Sweden and Slovenia. And these are the countries that have supported financially investing in the CHAMPS rollout. But of course, the other countries that are involved in CHAMPS are supporting CHAMPS by funding their own national implementation. And for that, we're also really grateful. So, thank you.
Thank you, Karen, for giving this wonderful presentation on this great project, and also honoring the member states who are making it possible as well. So we are following up on the developments of CHAMPS. So our next speaker is sitting next to me, Mr. Christian Klaar. He has been a teacher for a lot of years and is now a headmaster of a secondary school in Vienna. And he has written a few books as well. What's going on in our schools from 2024 and how can we save the future of our kids, 2025. And he will speak on the role of schools. So the floor is yours.
Can I have the power?
Yes. I hand it back to you.